All right, let's dive into one of the absolute cornerstones of economics, supply. It's the other crucial half of that famous supply and demand duo, and it really explains the behavior of anybody selling anything. We're talking giant companies, small businesses, and, believe it or not, probably you. So let's start thinking like a supplier.
Now, really, think about it for a second. Even if you don't run a business or have a side hustle, odds are you are a very active supplier in a huge market. So what on earth could you possibly be selling?
Yep, that's it. If you have a job, you are a supplier. You're in the business of supplying your time, your unique skills, your effort, and you sell it to an employer for a wage. Understanding supply gets a whole lot easier when you realize you're already doing it. So here's our game plan for this explainer. First, we're going to pin down exactly what supply means. Then we'll get into the big one, the law of supply itself and what its graph looks like. After that, we're going to clear up something that trips a lot of people up, the difference between moving along the supply curve versus shifting the entire curve. And we'll wrap up with some really cool examples where the law doesn't quite work as expected.
Okay, first up, let's get a proper definition here. When an economist says supply, what are they really talking about? Because it's a bit more specific than just, the amount of stuff sitting in a warehouse.
See, it all comes down to two absolutely critical words, willingness and ability. You have to have both. I mean, a car company might be willing to sell you a brand new car for $10, but they definitely don't have the ability to do that without going bankrupt. And on the flip side, they might have the ability to make 1 million cars, but they aren't willing to sell them at a huge loss. Real economic supply needs both. All right, section 2. Now that we know what supply is, let's get to the fundamental rule that makes it all tick. This is the law of supply, and it pretty much explains, in a nutshell, why more money means more stuff gets made. To put it simply, when the price of something goes up, sellers want to sell more of it. Makes sense, right? And when the price goes down, they want to sell less. It's a direct relationship. Now, that little phrase at the end, other things being equal, is super important. It's a key assumption we're making for now, and we'll circle back to it in just a bit.
And here it is, the law in picture form. This is your classic supply curve. You can see it plain as day. It slopes up and to the right. As the price on the vertical axis goes up, the quantity producers are willing to sell on the horizontal axis goes up too. But why? Why does it look like this?
Well, it boils down to 3 main reasons. First, and most obvious, is incentives. Higher prices mean bigger profits, and that's a huge motivator to make more stuff. Second, think about rising costs. If you want to make more of something fast, you might have to pay your workers overtime or fire up old, inefficient equipment. You're only going to do that if you can sell your product at a higher price to cover those costs. And finally, opportunity cost. If you're a farmer, making more chicken means you have less land to grow tomatoes. You'll only make that trade if the price of chicken gets high enough to be worth it.
Okay, time for section 3. And this is a really critical distinction, so let's focus in. We're talking about what happens when you just move along the curve that's already there. This is what economists call a change in quantity supplied. Remember that other things being equal phrase? Well, here's where it comes into play. The fancy Latin term is ceteris paribus. It just means, for this exercise, we're assuming that nothing else in the entire universe changes. Not technology, not labor costs, not the weather. The only thing that changes is the price of the product itself.
So look at the graph. If the price is low, say $50, producers are at one point. But if the market price suddenly jumps to $250, they're not reinventing their business. They're just reacting to that new price signal. They move up along the same exact curve to a new point with a higher quantity. That's it. It's just a change in the quantity supplied.
Which brings us to section 4. What happens when the real world gets messy and those other things don't stay equal? Well, that's when you get a much more dramatic event, a change in supply itself. The whole curve moves.
Okay. This is probably the #1 thing that trips students up, so let's be crystal clear. A change in quantity supplied is just a response to price, moving along the same old path. But a change in supply? That's a whole new ballgame. It means the fundamental rules of production have changed, and you have to draw a completely new curve. Here is the perfect example. Let's say you're a chicken farmer, and suddenly the price of chicken feed goes through the roof. Now it's just fundamentally more expensive to raise a chicken, no matter what price you sell it for. The result? The entire supply curve literally picks up and moves to the left. At every single price point, farmers are now willing and able to supply less chicken than before.
So what causes these big shifts? Well, here are the 5 main culprits to watch out for. A new piece of technology can make production cheaper. shifting supply right. The price of inputs, like our chicken feed example, is a huge one. The prices of other goods a producer could make matters. Your expectations about the future play a role too. And of course, if you just get more suppliers in a market, the total supply will increase, shifting the curve to the right.
And that brings us to our last section. Now that we've got the rules down, let's look at the fun part, the exceptions. These are the weird cases where that nice, clean, upward-sloping supply curve gets a little bent.
So when does the law of supply go haywire? Well, think about perishable goods. Sellers might actually sell more at lower prices just to get rid of it before it rots. Future expectations can cause a panic. If everyone thinks the price will crash tomorrow, they'll flood the market today. Then you have rare articles like a famous painting. The supply is completely fixed. No matter how high the price gets, you can't make another one. And finally, agricultural goods are often limited by the harvest. A farmer can't just create more corn mid-season, even if prices skyrocket.
You can just picture it, right? A farmer at the end of the market day with a truck full of fresh strawberries. The clock is ticking. At this point, the main goal isn't to get the highest price, it's to sell them before they spoil. So they might actually lower the price to encourage people to buy more, which is the complete opposite of what the law of supply usually says.
And this quote is the perfect way to wrap things up. These models, these curves and shifters, they're incredibly powerful tools. But we always have to remember that the real world is a messy place. Things don't always happen instantly, and people don't always act in perfectly predictable ways. Economics is the study of human behavior, and that's never simple.
So, we've gone deep into the world of the seller, the producer. We know why that supply curve slopes up, and we know what can make it shift. But that is only half of the equation. The really big question, the one that determines the price of almost everything, is what happens when this upward-sloping force of supply smashes into the downward-sloping force of demand.
You know, for most things we buy, the rules are pretty straightforward. If there's more of something, the price usually drops. But some markets just don't play by those rules. In fact, some markets are a complete puzzle. And today, we're going to try and solve one of the biggest puzzles out there, the truly strange economics of healthcare.
Okay, let's start with a question I think we can all relate to. If you need a new TV, you can spend hours, maybe even days, comparing prices, features, and reviews. But when you need surgery, that kind of comparison shopping is, well, it's pretty much impossible, right? Why is that? This one simple question really opens up the whole fascinating and honestly kind of bizarre world of healthcare economics.
So, here is the first big piece of the puzzle you have to understand. The healthcare market doesn't just bend the normal rules of economics, it completely shatters them. It's basically playing a whole different game.
Just look at this contrast. On one side, you've got a normal market. You know, we're supposed to be informed consumers buying pretty standard products. But then you look at the healthcare market and whoa, it's a totally different beast. You've got information asymmetry, that's a huge knowledge gap. The product is heterogeneous, I mean every single patient is unique. And then you throw in third-party payers like insurance companies, and that just complicates everything for everyone.
And it gets even weirder when you think about the service itself. First off, the quality can be all over the map from one doctor to the next. Then, the product is actually made and used at the exact same moment, right there in your appointment. And you can't see or touch a diagnosis, right? These features make healthcare totally different from, say, buying a car.
And all of this really comes to a head in the single most important relationship in all of healthcare, the one between a doctor and their patient. And this is where we really have to dig into that key idea we mentioned earlier, information asymmetry. It is the absolute core of this whole thing. Simply put, your doctor knows all the medical stuff, but you're the only one who knows your symptoms and what's important to you. This massive imbalance of information is a huge reason why the normal rules of a market just completely fall apart here.
You see, that knowledge gap creates what economists call an agency relationship. Because you don't have the expertise, your doctor has to act as your agent, making choices on your behalf. And this quote just nails it. The physician basically creates the demand for their own services. And that's the central tension, isn't it? You have to trust your doctor is doing what's best for you and not just what's best for their bottom line.
And that idea that the doctor is your agent leads us to one of the most mind-bending, controversial ideas in all of economics. It's this bizarre phenomenon where having more doctors doesn't necessarily lower prices. It might actually increase the demand for medical care itself.
Okay, so check this out. Economists were looking at the data, and they found something really strange. They saw that in a lot of places, both the price of healthcare and the amount of care people were getting were going up at the same time. Now, your basic Econ 101 class tells you that if the supply of something goes up, like more doctors, the price should go down. But that's not what was happening. And this weird situation gives us two very, very different stories.
All right, so story number one is the easy, common sense explanation. Something happens, like a bad flu season or some other local health crisis, and that causes a big spike in demand for doctors. People are getting sick, they need care. So naturally, more doctors move into the area to help meet that need. That's a simple shift in demand. Makes perfect sense, right?
But what if that's not what happened? Story number 2 flips the entire thing on its head. This story says the number of doctors went up first. Maybe a new hospital opened up nearby. Now you have more doctors competing for the same number of patients. So to keep their incomes up, they can use their position as your trusted agent to recommend more tests, more follow-ups, more procedures. In this story, the supply of doctors actually creates new demand that wasn't there before.
Right, so this crazy idea actually has a name. It's called supplier-induced demand, or SID for short. And let me tell you, it's a huge hot-button topic in health economics because it points to a massive market failure. It's the theory that because of that information gap we keep talking about, doctors might be able to, drum up a little extra business to meet their own financial goals.
So this whole supply creates demand thing gets even more tangled when you step back and ask a really basic question. Where do doctors even come from? Because, let's be honest, you can't just fire up a factory and crank out more doctors.
The best way to picture it is like this long, slow-moving pipeline. People go in one end as students, and then, years and years later, they finally come out the other end as a doctor or a nurse. And this long, slow process has huge consequences for how the market can, or really can't, respond to what we need.
And let's get real about what this pipeline means. It can take a decade or more to train a doctor. That means the whole system is incredibly slow to react. If we suddenly need more heart surgeons, we can't just get them. Graduates come out with a mountain of debt, which affects their choices. And on top of all that, it's a real struggle to get doctors to the rural or underserved areas that need them the most.
Okay, so information gaps, demand created by suppliers, a super slow supply pipeline. Why does any of this economic jargon actually matter to you? Well, because it has very real, everyday consequences for all of us.
Let's just break it down. That big information gap. It could lead to you getting treatments you don't really need. That supplier-induced demand idea, it's one of the main suspects for why healthcare costs just keep going up and up. And that long, slow training pipeline means that when we have a shortage of doctors in a certain area or specialty, it's a problem that can take literally decades to fix.
And that leaves us with one final, really important question to chew on. We've seen that the economics of healthcare is just different. Your doctor is both your trusted caregiver and a supplier in a very weird system. So if your doctor is also running a business, what does that mean for you as a patient? It's really the central question at the very heart of this entire healthcare puzzle.